patients are at the mercy of their primary care physician, have the luck of what I call the referral lottery as to whether they're referred to a general surgeon, to a vascular surgeon, or a skilled interventionalist. Hey, who am I playing golf with these days? Oh, my buddy over here is, treats blocked arteries. So, I'm just going to send them to that person.
Yeah.
Can you describe the different physician dynamics and skill sets and why it's particularly important to have a skilled interventionalist on your side and on your team?
Sure. With diabetics, it's different than patients that present with smoking. Patients may present with claudication. With diabetics, it's a really different process. And these patients are going to have disease below the knee and below the ankle. And you need to recanalize those vessels, and you need to have inline flow all the way down to the foot. And if you don't do that, if you really don't focus on that, you're really not going to make a major impact on wound healing and rest pain. And this is a different skill set. And I think about 10% of the country is doing this. There's only a select group of physicians that are doing this. And I think the training needs to be put out there to vascular specialists to really focus on this aspect of peripheral vascular disease. And that's really, you have to learn the skill sets of getting catheters and wires into the foot and really opening up inline flow to these ulcers.
And, I have quite a few patients. I hear this all the time. My doctor is the big title at this big name hospital, and why would I listen to this random doctor, despite degree, in an office-based lab versus this well-known hospital that sounds like they know what they're talking about? And, I trust them. I mean, how do we shift this paradigm? Because we know different. We have those numbers. I look at the CMS data, the database. I know who amputates and who doesn't, and I know who does most of the amputations. So how do we shift this paradigm for patients when selecting a doctor so they're no longer using title and credential, but instead proven skill set as their primary measurement?
I think it's a difficult problem because, it's a perception is reality. I mean, you look at a Vanderbilt or a Harvard, you say, well, it's Harvard, it's Vanderbilt. They don't understand. I had a physician that thought about coming to our practice, was at Northwestern, and he came out to watch one of our physicians in Arizona, and he said to me, I couldn't believe it. And he goes, I'm on the speaker circuit. And he could not believe that one of our physicians could recanalize multiple vessels going into the foot. And he said, I was really impressed. He told me, he said, I'm on the speaker circuit, and maybe 5 or 10% of the country is doing this. There's not many people doing this kind of stuff. So it really needs to be education to the community and outreach. And part of it's on us. We need to educate our referring physicians, our podiatrists, our internal medicine people, what we can do. A lot of these physicians say, okay, well, he's a vascular. They all think we're doing the same stuff.
Right, they do.
And to tell somebody we're recanalizing the foot, I mean, look, these internal medicine physicians aren't going to understand that. They don't understand that. So a lot of it comes down to really educating them, and also they need to see the results. So when we're healing ulcers, we're fixing their foot pains, their patients are going back to their primary docs and seeing that. That's our best advertisement. And that's the only way, because it's like anything. You hear Harvard or Vanderbilt, or you hear these big institutions, that's what people are going to think. They just don't know. And it's got to get out there. And it's as part of it, your organization gets the information out there, but we need to sort of get it out there by our results.
Yeah, I think the patient should take it upon themselves, if they can, really to ask that provider detailed questions. How many of these have you done, or what's your familiarity with this procedure? What are other procedures that you think are effective? Because you don't necessarily want the person who's got 30 or 40 or 50 journal articles but only does 1 or 2 of these a year. And I think the providers, certainly at Modern Vascular, we do a lot of these every day, and every week we're doing a lot of these procedures. This is something that we see with a lot of frequency, so we're able to tease out some of these nuances. And I think if you're a specialist, you've got all the journal titles, you've got all the publications, you've got all the speaking engagements. But if you only do one or two of these a year, you're not really a specialist when it comes to treating these type of problems.
Well, I really appreciate you both, and we really appreciate having Modern Vascular and all of your Peter Loop specialists opening up new facilities in areas they need them most. So thank you so much.